I will discuss and explore a bit the situation in Lebanon, read the issue of resilience. Given that what happened in the last 4 years, which is the life force also of the project, and what happened in Lebanon, sort of the tip of iceberg of the entire healthcare system in Lebanon, at least after the civil war in 1990. So this is Lebanon, a small country of, well, this slide is about numbers, and numbers in Lebanon is quite a big question mark. There's no consensus since 1932. So no one knows exactly how many Lebanese are in Lebanon, and no one exactly used the numbers in a sort of non-political way. All numbers in Lebanon, I guarantee, are very positive, including, of course, refugees. The new refugees, the number is between 1 million and 1.5. But there are few numbers. There is a registered refugees by UNHCR, 800,000 Syrian refugees. By the government, they said 1.5. By the General Security, they said 2.3. The newspaper, said that 3 million Syrian refugees. So they use all these numbers. So it's very difficult to think about the number in Lebanon. And the same even within all refugees in Lebanon since 7 decades, the Palestinian refugees, also the number is quite up and down. But luckily in the last, usually the number that we use is 500,000 Palestinian refugees. But in the last, I think in 2017-18, they did a sort of effort by UNRWA, the UN agencies, so that the number went by to 250,000 Palestinian refugees. There is also, as for Lebanon is not a signatory of the 51. So refugees in Lebanon are not refugees legally. So they are considered displaced. And that's the word that they use it in Lebanon. That, as for Syrian refugees, which is, among a long list of numbers, I think this is an important, because the majority are women and children. More than half of them are under 18 years old. And thinking about this number, about the future of refugees is something that we need to think about. Second. So I think you've heard this issue of shocks, in the last 4 years that affected Lebanon. Usually we're talking about, the refugee crisis, which is, I hate using the word the refugee crisis. It's a, tricky word. Over that, the economic crisis started in October 2019. So when the lira, the national currency started, devaluated quickly, and then over that, the COVID-19 pandemic, and on the top of them, the Beirut blast. And every time we use Beirut blast, I think people who went yesterday, they saw what blast is. It's something considered the largest, explosion, non-nuclear explosion since the Second World War. So it was really a horrible experience talking about this. Just to reflect some numbers next, please. From the World Bank that considered Lebanon one of the top 10 most significant global crises since 19th century. Frankly speaking, I don't know how they calculate that since 19th century, but yes, the inflation is so high, and only in 2023 it reached like a sort of 172%. The NSSF, the National Social Security Fund, is the public fund usually for national security that covered only 10% during the economic crisis. So only 10% of the cost of healthcare services, were at the 90% of the cost are paid out of pocket or by other payments. So the out of pocket actually payment went up from 33% in 18 before the crisis into 55 in 2022. So we see that the out of pocket payment come very high, which of course affect the access to health. There's a lot of expenditure on medication, on pharmaceutical medication, which is 25% of the healthcare expenditure. But now we have a sort of a drop down, in terms of the availability of medication in Lebanon, so almost like a 50% less than before, and 70% of Lebanese have no access to medication. And this one, just to describe the structure of, is it clear? I'll try to explain it, the structure of the health system in Lebanon. This paper actually was published in 2016 or 17, but still you can think about it the same way, just to tell that the pre-existing, structure or the fragmentation of the structure still there. So, to show about three functions of the health system: stewardship, financing, and delivery among different group population, which tells a lot about how many parallel healthcare system in Lebanon. So for non-poor, they're having two actually system. So either socially insured or non-insured or privately insured. So for both, actually, this is for non-poor, will be partially Ministry of Public Health, and through the National Social Security and other insurance scheme, and delivery through the public and private sector. Or could be only private sector and out of pocket expenditure or finance model through the private sector facility. The main issue, so it's either public or private, but the main issue is for those who have no enough access to
what you're saying, Fouad, that's completely reversed, right?
Yeah.
So this paper is completely out there in respect of the
Exactly.
This was in 2016. Exactly.
That will tell a lot. So that's an issue that shows a lot about what happened in Lebanon. So there are, according to different population, you have a different stewardship or different agency and different model of finance. So, for example, for vulnerable Lebanese, should be through the MOPH should be Ministry of Public Health. But as Sophie mentioned, now we see that it's 80%. As you've seen the number before, it's 85% out of pocket. And that time it's mainly for Ministry of Health expenditure. There's a system for Palestinian refugees, whether are old refugees in Lebanon, that's Palestinian refugees in Lebanon, or Palestinian refugees that came from Syria after 2011, and both served by UNRWA. This is a UN agency for Palestinian refugees. It's a parallel refugee agency to the UNHCR, that's for other refugees. It was a special agency established in 1950 to address the need of Palestinian refugees in the three neighboring countries, Lebanon, Syria, and Jordan. And the mandate at that time was 3 years, a sort of emergency to meet the initial population. Unfortunately, since then, every 3 years, they renew this emergency response agency up till now, and to address. The major issue that happened in the last few years, that the mixed marriage, people came from Syria with a sort of mixed marriage, Palestinian, husband with like a Syrian wife, and so where they go to seek their services. It made a lot of problems, for the structure in access to healthcare. Exercise that we did about the mapping health system resilience in Lebanon using the desk review and interviews. Next, please. And this is just to show the methodology. We examined publications, including 84 records, 70 as a peer review article, and reports from different agencies, including Ministry of Health and UN agencies. Next, please. And also we did key informant interviews. Next, we can move these issues. So this is some of the findings from the exercise, and we divided it into 3 different levels. The one is about the governance level. So the Ministry of Health, the main leader of the health system in Lebanon, have a sort of major issues related to the governance issue. It's a weak organization structure, insufficiency of qualified human resources, and poor infrastructure. So, in addition to this, and especially in the last 3 years, we saw that from literature, but also from interviews, there's a sort of a lack of accountability, for in the system that led to corruption, a struggle to control the sale, the distribution, and smuggling of counterfeit drugs, which is a major issue. And then, that what happened in 2021, where difficulty to have access to the bank system for the drugs. Then we start seeing that counterfeit drugs in the market that made a lot of problems. Next. Also, there's a sort of lack of coordination between different financing agency, and that created silos, and sort of disconnection between these agencies, and on the top is the absence of political will to overcome these gaps, so to get this challenge. On the financing level, so there's a sort of insufficient source allocation. The issue of budgeting doesn't reflect the performance indicators, so there's a sort of discrepancies here, limited resources, especially in the primary healthcare, which is a chronic issue in Lebanon. Investing in primary healthcare is less than investing in the hospital-based care. And that's what, Lebanon historically known as a sort of a hub for high-tech healthcare. So with the big hospitals in Beirut, attract many patients from the neighboring countries. I'm talking about before the crisis, now less. But still, the high-tech hospital care are the main structure for the healthcare system. Just 1 second. About the devaluation of the Lebanese lira, it actually it led to have a sort of increasing the medical cost and put more problem on the insurers themselves. What happened that now the private insurers start asking the payment in US dollar, which affect, of course, the issue of access to for the low middle income beneficiaries. Next. On the delivery level, still the private sector is the dominant of the healthcare providers. In addition, now after 2020, 2020 have increased more in the NGOs that also work to provide services. So during the because of the crisis, many skilled health workers left the country, and that actually affect, and mainly in the main cities, that affect the high-level skilled workers and sort of and lack of access to secondary care, whereas still the primary care and the mechanism that changed with having introducing the informal sector, as you've seen maybe in the field work, that filled a bit the gap. Issue of also mentally in Lebanon, also historically, they prefer the brand name drugs over the generics, which is now start to see change in this sort of mentality. Next. And still, the reports mentioned about this national routine. However, the implementation of this emergency plan lagged, and also the limitation of the Ministry of Health capacity to control this implementation, especially on the peripheral areas, in outside the major cities. Next, please. Still, Ministry of Health theoretically is leading the healthcare system in Lebanon, but the impact actually on enforcing some sort of services are quite difficult. Next, stay with the issue of collaboration. This is a major issue since long time about how to coordinate between different providers in Lebanon. Ministry of Health. There are several ministries that offer service. Ministry of Health, Ministry of Social Affairs, Ministry of Defense for military people, in addition to the private sector. Collaborating between all these different actors, quite an issue. Next. So that could be the roadmap to recovery, strengthening governance and control, building a stronger healthcare system through primary care, which is start seeing that because shifting, people are forced to shift toward more primary care because of the increasing cost of the secondary and tertiary care, especially in the remote areas. Investing in the local capability and capacity, that what we start seeing on a municipality levels with more investing there and start having their own structure and increasing or investing to enhance the coordination. Next, I think. So the multi-crisis exacerbated what already exists in Lebanon. It's something that it brought, this crisis brought new issues, but also exacerbated the existing one. There's a sort of a big question about, the state ability to provide a safety net, and that push more and more toward more decentralized structure. The humanitarian effort increased in actors and resources, but that what happened with having more NGOs, more international NGOs, but still the question of coordination is a sort of exists. The informal sector, which is we see that now increasing, the services by informal sector that we start seeing in different municipalities. Mainly it's mixed of Syrian health worker providers and Lebanese of sort of working together on this, and it seems that municipalities emerge now as maybe a new model to have decentralized healthcare services in multiple places. Thank you very much.